Hi there, this is State Representative Roger Bruce, and welcome to this week's edition of Under the Gold Dome. I have my colleagues here, and we're going to talk about a variety of subjects today. And I'm going to let each of them kind of intro theirs when it's time to do it. We wanted to talk about different things, and then at the end, we have an exciting announcement that will be made. And for most people that haven't heard it already, it will be exciting. For those of you that have heard it already, it will be exciting again. So, so anyway, we're going to talk, as I said, about different topics. And one of the topics that I wanted to talk about was reparations. And well, before I do that, let me let everybody else say hello. You guys say hello, then we'll come back.
Hello, it is Senator Sonia Halpern, District 39, back here for another Friday on Under the Gold Dome. Thank you for joining us here today. So much has happened kind of in the world that we are living in the last week since we met. And so we might get a chance to talk about some of that as well. But welcome back. Great to be here with you.
Hello, everybody. I am back, Representative Deborah Bazemore. I'm so glad you continue to tune in to Under the Gold Dome, and we have some exciting subject matters to talk to you about, and hopefully you are ready and you have your questions ready. Thank you for participating.
Derek?
And it's Happy Friday. Listen, Representative Bruce. Last week, the good senator was on location. This Friday, I'm on location. And so I'm outside of District 64 right now, down in Henry County, McDonald Stockbridge, just doing the work for the people in Fort Georgia. And so, but it is Friday to Representative Bazemore. Good to see you. Welcome back. And let's go ahead and get started, Bruce. It's Friday.
All right. Well, like I said earlier, one of the topics that we wanted to talk about was reparations. We all know that this, country has not treated African Americans very well. And we are all descendants of slaves. They promised us this 40 acres and a mule, which I have not seen yet. I haven't got my 40 acres or my mule. And not that I want a mule right now, but the point is, what has happened is that the slave owners passed on the concept of passing wealth from generation to generation. And our ancestors, because of what was happening back then, they passed on dependence. Food, clothing, and shelter, go somewhere else and get it. Your parents, my parents, probably told you go to school, get a good education so you can go beg somebody for a job. I mean, is that a fair statement? And they may not have said it that way, but that's what it boiled down to. And then you work through your 20s, through your 30s, through your 40s. And then when you're getting ready to go in your 50s, they come and they say, well, wait a minute. We appreciate all that you've done for us, but we don't need you anymore. And then you get laid off. And then you're trying to figure out, okay, what do I do after that? Your whole life, you've been working to help somebody else meet their dreams. And what we want to do is create an environment. Instead of telling my kids to go to school, get a good education so you can beg for a job, I tell them go to school, get a good education so you can create your own future, live your own dreams, do the things that you want to do. And I'm hoping that that's what we send with this new message. So one of the things that I have introduced was House Bill 541. And what that bill does, it creates a commission to look at the impact that slavery has had over the years on African Americans and come up with recommendations on how to, compensate for all that was taken from us. And hopefully that legislation will get, some traction and that we'll move it forward. Hopefully there's some others on here that were involved with putting this thing together, Tamara and Rodney. I think they're going to join us at some point here. And but anyway, that's what I wanted to talk about. What do you guys think about reparations? What's your thoughts, Deborah?
So, thank you, Representative Bruce. And I think this is long overdue. I think what we grapple with is, what does it look like? What do we really want? And I think once all of us get together and there is a consensus, I think then we can definitely move forward and demand. We see that there are some ethnicities that have been given reparation, if I say. And I believe that we have built this nation, this country, and we should be recognized for it and compensated.
Mm-hmm. I agree.
Yeah, there is conversation even at the national level. I think literally in the last week, I just heard that several Congress people sat down with the President Biden to discuss this issue of reparations as well. I would like to see, if we're going to do something, what I would like to see is something that impacts the community in ways that is iterative and generational. Sometimes people talk about reparations and they speak of it, in terms of like the 40 acres and a mule, each individual actually receiving something. I actually worry sometimes that does not actually create the kind of generational change that I would like to see reparations ultimately achieve. So I tend to think of it as, how do we invest in our communities? How do we, definitely we got to allocate dollars, but how do we take the allocation and invest it in communities in a way that it does change individual families' lives, but also the children and the grandchildren of those folks, and not just me as an individual, or not just my nucleus as my own family, but how do we make it reverberate out and actually last longer?
Derek, what's your thoughts?
And I appreciate both Senator Alfred and Representative Bazemore thoughts on this. I guess I have it in three different parts. The first part is, let's change the name of reparations to something else. Because when you say reparations, that immediately brings up defenses. And in order for us to have a conversation, you don't need for those who sit at the table to put their defenses immediately when they talk about reparations. The second part is this. When you think about what your bill on for, you're simply just saying, hey, let's see this, right? Let's see what that really looks like and what it should be defined as, right? Because there's no way that you'll be able to, if I ask what the value of 40 acres and a mule, if it was given to our ancestors, let's say 200 years ago, over 200 years, compound interest, that acre at 40 acres and a mule might look like $2 million or $3 million. I don't know, but I'm just saying for the conversation, right? And so, and the third part is this. After we redefine the name, after we define what that looks like in terms of value, the third part is who gets it, right? Who gets it? And the reason why that's going to also be important is because we've watched reparations for other cultures. They just don't call it reparations. They call it legacy. They call it inheritance, right? But they have different names for it. But those forefathers of others did things 150 to 200 years ago for their families, and their families of today is benefiting from what their parents did 100 years ago. And so I just think once we, look and study it what your bill is calling for, Representative Bruce. I think to have meaningful dialogue on what it looks like, how it should it be defined. You know, some people will say, "Oh, it could just be a check in the mail," or some people may say, "No, I want my land that your grandfather took from my grandfather because my grandfather didn't know any better when they signed this contract with X. He didn't know that he was signing over our family farm, and so." So reparation could come in different forms. I think that we should study it, have a conversation, and define it. But we got to start by saying let's talk about reparations. Because if I say tax cut, people are like, "Oh, tax cuts are fine because we do tax cuts all the time." That's a form of reparation.
Yeah.
It's a form of reparation, right? And so, but yet they don't want to say that tax cuts and reparation are synonymous, but in the essence of what it's doing, it is, right? If you give billionaires all these tax cuts, that allows for them to make more billions of dollars than they're helping their family, right, for years, centuries to come, right? So let's have a conversation. There's no harm in having a conversation, and I think your bill helps set up that framework to study it, have a conversation, and define it, what it looks like in the state of Georgia.
Yeah, and I think it's going to look different, you know, from person to person. What were you going to say, Sonia?
Well, I was going to just add that the thing about reparations, right, is what is it trying to do? And if the answer, part of that answer surely is, it is trying to acknowledge the history in this country and also acknowledge, I'll say repair, right, a little bit the gap that we see in this country because of institutionalized racism, structural racism across all of our different institutions, frankly. And so the idea around the interesting thing about the tax cuts and bridging that kind of concept to a concept of reparations is that it is about somewhat generational wealth building. And for us, that we've been denied that, you know, kind of as a large group, we have been denied that because of institutions and the way they've operated. And then how would we take then the dollars in a way that would reinvest, but also start to generate some of that generational wealth? I wanted to just read one comment that we got, Mr. DC, hello, who says, I think we should approve $50,000 per year per ADOS for 50 years.
So I thank you, DC, for that comment. I just wanted to add that we did get the apology acknowledgement. So I believe, Representative Bruce, that your bill is the next step. And I can also appreciate the fact that when we worked so hard to create the city of South Fulton, your challenge, not challenge, but your determination was that would create wealth for our children and our children's children. So yes, let's move forward with that.
All right. And there is a question down at the bottom there from Rodney Littles. Was the state or has the state implemented any programs to increase purchasing from Black and Brown owned businesses other than GDOT? And to my knowledge, the answer to that is no.
I don't know that they have either. What I will say is the one thing that I've seen more recently is that, and let's just be honest, right? The percentages, the kind of the percentage of contracts that are given to our minority-owned businesses, Black and Brown-owned businesses specifically, it's a very low percentage. So we've got to set our sights on much higher percentages as goals. I believe that it has risen. It has risen, but like from 1% to 1.5%, right?
Mhm.
So I mean, we've got a lot of more room to grow,
Yeah.
and frankly, expanding to departments other than GDOT is it just makes sense. Like it doesn't make any sense that it's narrowly defined in that one area of contracting.
And just so everybody knows, because he may not say it, but Representative Bruce has a bill that has been introduced year after year after year to improve that percentage. And so we're going to continue the fight, right, Representative Bruce?
Amen. All right, let's move on to if anyone is still out there and you have questions on this topic, go ahead and post those questions and we'll come back to it. But in the meantime, let's go to Senator. What is the topic you wanted, Senator?
Well, I wanted to talk a little bit about women's health, and even more specifically, women's maternal health. Because, and I just, to set the context a little bit for this conversation, I want to just say a few things. In 2010, Amnesty International actually flagged Georgia as the state in the country with the worst maternal mortality. So this is going back 11 years ago now. And so what does that mean? It means that Georgia's one of the most dangerous states in America for a pregnant woman, and even more so if that woman is Black. Fast forward 6 years later, and let me just say, 2010, that report came out, and it definitely did generate, interest even within the state and within legislators to try to figure out how do we change that, because that's not a trajectory we want to be on. In 2016, Yale School of Public Health found that the pregnancy-related maternal mortality ratio in Georgia is basically just under 41 per 100,000 births. But to put that in context, that means that the maternal death rate for white women is more than 2 times that for white women nationally. And the maternal death rate for Black women is 2 times that for white women in Georgia, and 6 times the rate for white women nationally. This also means that it's 7 times higher than the state with the lowest maternal mortality rates. We are more likely to die by pregnancy than women in 24 other industrialized countries. Mm-hmm. So this is not this is definitely the kind of thing that we need to look at and figure out what to do. Money was appropriated, $2 million or so, to start to do a review around this and try to understand what are some of the mitigating factors around it. And so work has been done, but I'll tell you where we are right now and what are some of the contributing factors. There are a number of barriers of access in our state. Part of the issue is that this is an astounding statistic, but half of Georgia's 159 counties do not have an OBGYN. Mm-hmm. Half. We rank 50 out of 50 in maternal mortality. Obviously, I said that. We also rank 48th in the U.S. for healthcare coverage for women generally, with many of those women living in rural areas. Well, what does the rural part have to do with it? We have a study that found that women who must drive more than 45 minutes to get to the closest, this is labor and delivery facility, were 50% more likely to experience preterm delivery and other complications. So part of it is access, literally access to good health care while pregnant. The other piece is insurance access. And there is a huge gap that is created by the state's decision not to expand to Medicaid. And so therefore there's a big coverage gap, because we haven't made that expansion. Just yesterday, so last year, legislation was put through to expand our Medicaid coverage for pregnant women who live at below the poverty level. I'm going to give you this exact. It would allow income eligible mothers to receive Medicaid benefits. Right now, it's at 2 months postpartum. It would expand it to 6 months postpartum. And that was something that had to be approved by federal officials. And just yesterday, we got notification that they have approved Georgia's plan to expand Medicaid coverage for those low-income new mothers in the state. So that is fantastic news for Georgia women, particularly low-income women. The other thing that has happened that I do want to raise is that this legislative session, and I believe this, I don't know that this bill has yet been signed, but it's sitting on the governor's desk, would extend coverage income, it would extend the coverage for low-income mothers with newborns and allow their newborns to also be able to be seen for a longer period of time post-birth, because so much happens to both the mother and the child kind of just following birth. So we're making some progress, I would say some baby step progress. But I do want to acknowledge that there's some progress there. But pending so there's that. The other thing that we did as state lawmakers this year, we passed separate legislation that creates an easier path for low-income Georgia's children to automatically start collecting Medicaid benefits if they're already eligible for food stamps. So it looked at the determinant of, SNAP recipient and used that to then say, let's extend that coverage. That has not yet been approved from the federal government, but if it does, that automatic enrollment would allow an estimated 60,000 Medicaid eligible children who receive food stamps to also join our state federal health program. That's not on maternal health, but you see, there's these huge issues, and at the end of the day, we really need to figure out how do we close the gap and how do we solve these crises, because it is a crisis. And quite frankly, Medicaid expansion, that's the answer. This is always the answer. Like for a decade, I think we've known Medicaid expansion is the answer to making sure that we can have access to good health care.
Yeah, we've been trying to get them to do that forever.
So, Senator, I just want to add a little history to what you said, and I'm so glad you were shining a light on it. And I see my colleague just biting at the bit because he has some more information about the expansion, I'm sure. I just want to shout out our former representative, Representative Able Mabel Thomas. She, along with the Women's Caucus and the GLBC, we worked hard on this issue, but she was the forerunner. She spoke out every chance. We talked about this for hours and hours and days every time we met. And she was able to get that money put in that budget for these women. So my hat's off to her, and we have to recognize her when we talk about this issue ever. Also, when you talked about how far that the women have to travel, and that's because you talked about the Medicaid expansion. Because they have not expanded Medicaid, there are a lot of hospitals that have had to shut down. So that leaves our women vulnerable and have to travel miles and miles and miles just to get the appropriate service, medical service that they need for themselves and their unborn, and when they have children, their born children. So I think, and I'm sure all of us are in agreement, just like you said, we have to expand Medicaid. It does not matter what president is in the White House. It does not matter what affiliation, Democrat or Republican. This has to do with all of the citizens of the state of Georgia. And we cannot turn a blind eye and not consider the health of those that we represent.
Okay.
Can I add
No,
one other thing?
healthcare.
Oh, go ahead, Representative.
Healthcare should be a nonpartisan issue. When you think about the stats that Senator Halperin just shared, and how Representative Bazemore broke it down, you realize that healthcare should be a nonpartisan issue. And unfortunately, this problem is such a huge problem that negatively impacts women. And Georgia is ranked the 43rd out of 50 states, 43rd when it comes to healthcare, and ranked 47 on women's health. For the very reason that Senator Halperin and Representative Bazemore highlighted. And when you think about that, as much as we like to tell when the state do business, Representative Bruce, you and I are not at risk when it comes to pregnancy. You and I do not have the requirements to dictate those things on a woman's body. And I always find it's just so incredulous that when it comes to women's health, men are on the forefront of drafting legislation.
Yes.
They determine how much resources, right? And that's the reason why it's so wrong on so many fronts, because you have men shaping women's health policy, right? It should be women shaping women's health policy.
Mm-hmm.
We should not have over half of the 159 counties without an OBGYN. We should not have nearly half of our counties without a pediatrician. We shouldn't be ranked number 43 come to healthcare or 47 for women's health when we keep saying we're the number one state to do business, right? There's a mismatch. And the reason why we have a mismatch is because you have men writing policy regarding women's health. I just think that's wrong. And I have 4 young ladies under my roof. There's no way I could tell them what they should do with their body, right? I can give them resources. I can console them. I could do all the things I could as a father. But in the end, those 4 young ladies under my roof, they have to get the necessary health care, and every county in Georgia should have those resources available so women can get the necessary health to sustain their life. That's the reason why health care should not be dictated by men, and this should not be a partisan issue. But unfortunately, it is.
I absolutely agree with you. I have 2 daughters and a wife, and quite frankly, they start talking to me about some of the things that they are dealing with. I try to relate to it, but I can't speak to the issues that they have like they can speak to the issues that they have. Now we got issues of our own too, but I don't see women trying to lead the effort on prostate cancer and some other things either. So we all have to deal with what we know best. And so I'm going to defer to my good friend the senator and to my good friend Representative Bazemore to help educate me. And when you guys come up with legislation that you need us to support, all you got to do is come to us and talk to us, and I'm pretty sure that we're going to be on the same page if it's going to help. Because I know whatever you do is going to help my daughter, help my wife, and help other women around the state. I think you had a comment or a question that popped up in there.
Well, okay, and I'm gonna read I'll read the question in a moment. One thing I wanted to note for everybody is that when Representative Bazemore was talking about hospitals throughout the state closing, 40% of the equipped labor and delivery facilities across the state have closed in the past 20 years. I mean, that's a lot of hospitals where women can give birth have closed. So we have work to do. I also want to say that this is not just a Georgia issue, this issue of women maternal mortality. It is not just a Georgia issue for Black women's mortality. And so we have at the national level, Congress people who have come together, and there is a bill that they are pushing, and it is that they've introduced, and it's called the Black Maternal Health Momnibus Bill of 2021. It's got about 12 different points in here. Each one of the 12 Congress people who are part of kind of the consortium that did this Momnibus bill have put forward the specific pieces that incorporate it, but it really does make critical, investments in social determinants of health, provides funding to community-based organization. It's a comprehensive study around the look of pregnant and postpartum veterans and the support that they can get through their VA maternity care coordination programs. It is meant to grow and diversify the perinatal workforce, improve data collection, support moms with maternal mental health issues. I mean, there is a great, really comprehensive approach and look that is happening at the national level. If that legislation passes, obviously federal legislation always takes precedence over state law. So this would become our law. But in the meantime, I will say you can certainly know that this is an issue of major concern to me, and it is something that I'm going to be digging into more, just even from a policy standpoint. And so Representative Bruce and Jackson, you may very well see coming over to the House once it gets through the Senate legislation that I introduce around additional steps that we can take and things that we need to consider to shore up this gap.
Well, I look forward to seeing it and supporting it.
Oh, there's a question. Okay, so
Here.
a statement actually from our friend DC. The state needs to pass full practicing authority to licensed nurse practitioners to run their own clinics throughout the state. And you make an excellent point there. And it really is a matter of how do we look at the resources, particularly in our rural areas, right? How do we look at the resources and the people who are trained and make sure that we're leveraging them so that women can actually have access to that quality health care?
All
despite
right.
the fact that the hospitals are closing, despite the fact that they might have to travel, to make it so that they don't have to travel, 60 miles round trip just to take a visit to see an OBGYN to be checked out during their pregnancy.
Got it. All right. Well, that was a lot of information, and I know that the ladies that are watching it got plenty out of that, and some of the men that are watching it, that have daughters, I hope you learned something from that as well that you can pass on. Sister Bazemore, what you got going?
Well, thank you, Representative Bruce. And I know we're winding down here on time. So what I wanted to talk about was COVID-19 in our children. So, we are still in a pandemic. Some people don't realize that a pandemic is still going on. So because people have started to get vaccinated, they believe that it's okay not to protect yourself or others. But we as adults, we know what we need to do. And we know that we have to wear our masks, wash our hands, social distancing, wash out, just make sure that we do everything that the medical professionals are saying. the medical professionals came out when we found out we were in a pandemic, that this COVID-19 came over to us, and told us that our children were safe. Children are safe. It's not going to affect them. Not a problem. And then when I started seeing that other states were reporting numbers of children, so I started doing some digging and found out that actually, yes, this is affecting children. And what we're finding out now, because there's so many more variances of this COVID-19 disease, these children now are suffering, and the hospitalizations and the severity in children have risen in the last several weeks. I don't know if you all have heard that Michigan currently has a record-breaking number of children who are hospitalized with COVID-19. So those people in Michigan have decided that it's safe. They've been lulled into a false sense of security and, calm. And so they have not been taking the precautions. And so because Michigan has this severe number now, and it's hit a high of 70 this week, 70 cases this week, we have individuals, public officials across the country watching Michigan. And that's quite concerning, because when I looked at the numbers that were reported from the Children and COVID-19 State Data Report, which is a joint report from the American Academy of Pediatrics and the Children's Hospital Association. And this date was as of 4/15/2021. You saw for the beginning of this year, the highest number was the week of January 14th for children. That number was 211,486 cases. Then the numbers started to come down as we went along. And so the week of March 11th, the lowest number was 52,695 cases. However, since that time, there has been a steady incline of children cases. And right now, today, the cases stand at 88,497 as of April 15th. So we see that, yes, it was going down because maybe we were observing the cautions that and the practices that the medical professionals told us. But when we started getting the vaccine, people started relaxing and thinking it's okay. And what I don't know if everybody knows, even though you get the vaccine, it does not mean that you will never get COVID-19 again if you've had it, if you're vaccinated. So we still need to mask up. We still need to observe those cautions when we are out and about and around people, because you may not have the symptoms, but you may be the carrier.
Right.
And yeah, so it is very dangerous. And we know that there are long-lasting effects of this disease, of this virus. Some people that have had COVID-19, they are still suffering months later with severe headaches, migraines, with muscle and their pains in their muscles and in their throat, different symptoms that they had during the time they had COVID. So we need to protect our children. And what happened, the reason why I sit here to do the weekly meetings, Zoom meetings, is because when I was on the COVID-19 response team under our caucus, I sat here because we talked about the children. And if you look up here, this picture I put up here on purpose, because I want people to know that you see that mother that's covering her child? That's what we have to do as adults. We have to be the protectors of our children. We have to observe everything that the doctors and the medical professionals are telling us. We have never had this virus before. So we don't even know right now, a month down the road, what it's going to look like. But if we all get on board and do what we're supposed to do, we can at least protect our children and protect each other.
Representative, given all that you just said, can you give any rational reason why it was announced that the that the Fulton County school system was going to eliminate the need for wearing a mask at their athletic events, that the graduation, they were not going to limit the number of people that attended, and they were not going to require them to wear a mask. Can you speak to that at all?
I really think that is a foolish move. I believe at that point, we will see the numbers spike once again, and will throw us probably into the state that we were in prior to us quarantining. And I think it's really about money. We keep saying it. We keep touting down at the Capitol, we are the #1 state to do business. So we know this has hurt our economy, but I would rather the economy be hurt than to lose children and my friends and family members. And let me just give you the numbers for us here. I'm not going to go through each group, but I'm going to tell you less than a year old to 17 years old, the increase yesterday of cases was 174. That was just here in Georgia. The increase of cases for 18 to 29, because that seems to be the age group that has the most problem with masking up and social distancing. That increase just yesterday was 281 cases. I don't know what's needed for people to understand that this is a deadly and dangerous virus and that we need to stay on course.
Yeah, and I see no logic. I see no logic for what they're talking about doing.
Not at all.
Did you guys have something you wanted to say on that?
Just quickly, because then we'll let Representative Jackson go. I just want to say I am wearing my sticker. I got my second vaccination today, and I did not take the sticker off for the show because I wanted to reference that as you were speaking, Representative Bazemore, yes, because we have an opportunity to get vaccinated. I know and understand that not everybody is necessarily kind of trusting of that, but I did want to just only add that Fulton County has vaccination sites. I happen to get mine through Piedmont. We've got hospitals, Piedmont, WellStart, that have vaccination dose. GenCare now has it also, which is in East Point and the West End. They now are offering vaccinations, which I'm really pleased to share. Mercedes-Benz has walk-in appointments. There are dosages to be had if you're ready to go and get it. And so I just wanted to remind people that. And even with it, in 2 weeks from today, I should be fully vaccinated. You will still find me wearing a mask. You will still find me washing my hands. You will still find me doing the social distancing, because it's still something that we all need to keep our eye on. We are nowhere near done with this yet.
And in addition, I was just going to add that those that need to be vaccinated, you can even contact your local Department of Health agency to find out what's nearest to you. And I found out that some of the Walmart pharmacies are also offering the dosage, and GICC. So please find out what's closest to you. And if you feel so inclined, which I hope you do, go and get vaccinated.
All right. And Impact United Methodist Church is offering that as well. So, all right, let's go to Derek over here.
Before I talk about my topic, I just want to add, I was looking at the news, and they were saying in Georgia there's going to be about 25% of Georgians who will elect not to get the vaccine for a reason, and then they listed various reasons. Some people think it was rushed. Some people think that, the whole conspiracy theorists out there, they gave about 3 or 4 or 5 reasons. And, I look at that and I started to internalize what they were trying to say, and I said, wow, this is coming down to trust. This all comes down to trust. And those same individuals, those same 25% of the population of Georgia that's elected not to get the vaccine are probably the same 25% that get on an airplane, have no communication with the pilot, don't know the pilot, don't know the qualifications of the pilot, will get on the airplane, fasten their seatbelts, right, and go up to their destination. But yet, they're questioning the scientists, the epidemiologists, the subject matter experts on why this vaccine is so important, and break down the history in this country, how vaccine, from a public health standpoint, has helped our society. We don't have to worry about polio anymore. We don't have to worry about smallpox anymore. We don't have to worry about mumps and measles and chickenpox, because we have these immunization shots that we start to give children as early as, I think my grandson started getting shots like when he was like 10, 12 months old, something like that. But my point is, this is nothing new. We've been here before, and it's just amazing that when we need to exercise trust, and I'm not just talking about blind trust, I'm just talking about trust, the experts, the subject matter experts, the epidemiologists, the CDC, but yet there's pushback because others think that for whatever reason, someone in a party said X, and they believe that, but unfortunately, their loved ones succumb to the coronavirus. And I think of that lady over in Arizona that got on CNN one time. She said, the only problem that my father ended up dying of the coronavirus because she believed the president that was the president at the time. She believed that president, and he was in his late 50s. He ended up dying because of what the former president said.
Yeah.
So, but hey, my topic though, listen, my topic, you all know me, right? And only certain things really get me hot and bothered. And we have witnessed the attack on our democracy at a particular rate in a way that I just never would have imagined in my lifetime. And I don't want to talk. I'm not going to talk about the insurrection, although that's still out there. The insurrection that took place this year on January 6th. But I want to talk about, and I'm not going to talk about Senate Bill 202 and voting. Right, that's still the topic out there. But what else is really bothering me is that 34 states have some sort of form of anti-protest legislation. Georgia being one, House Bill 289. Now you're probably saying, Representative Jackson, what's this whole anti-protest? We haven't heard that much about it. We heard about voter suppression. We heard about all these other things. House Bill 289 didn't really go nowhere, but it's still on the books, right? We may still deal with it next session, but there's this move afoot in these 34 states to silence the people. When it comes down to silence the people, you want to get me upset, get me angry, silence the voice of the people. That will get me very upset, because this whole premise of this democracy that we all live in is about hearing from the people, right? And House Bill 289 here in Georgia will go after peaceful protesters, right? I believe in the First Amendment. You should have the right to peacefully assemble. But House Bill 289 here in Georgia do quite the opposite. In fact, when you read this legislation, they're going after peaceful protesters with felonies. They're going to criminalize those who are saying to either to the government or to a corporation or what have you, right? Because you can protest anything, right? If you don't like redwood trees, I guess you can go to where redwood trees are and and protest against redwood trees. The point is, 34 states have some form of anti-protest legislation. Just recently, Florida passed anti-protest legislation that has felony and misdemeanor language. If you have 2 or more assembled, and if the law enforcement, 2, that's right. So if me and Representative Bruce just hanging out, and the law enforcement say, "Hey, I think you 2 are protesting," they can charge us saying that we're harassing, right, with a felony. And I just think that is so egregious. And we the people, right? You want to talk about the Constitution? We the people should push back on legislation like House Bill 289. We need to resist and protest when government, federal, state, county, right, municipal, are trying to take away the very rights that are the bedrock of our democracy. And I just want to highlight that today on this beautiful day down here in Henry County, McDonough, Stockbridge, that citizens have the right to exercise their First Amendment right. They have a right to protest. If they feel that they want to boycott, they have that right. And no government, no form of government should try to take that right away from the people. And House Bill 289 is a bad bill.
Representative Jackson, I'm so glad you brought this up. I don't know if you all heard, but I heard one of the states is going to protect individuals if they try to run peaceful protesters over with their vehicle, as we have seen done. And also, if I'm just standing there while a peaceful protest is taking place and it turns violent, they can also charge me for just being right there. So that's another state. So they are trying to concoct every kind of way to stop us. But one thing I am assured is that when you take away rights from people, you upset them to the point that they will come out and they will make a difference at the polls. We have seen it done already twice, and I am banking on our people to do the same thing again, because you cannot tell us what we can't do.
Yep. Yeah, and some of this stuff is ridiculous. Arresting people. All of us, well, not all of us, but I grew up, back during the period of time when peaceful protests, that was the way we got a lot of this stuff, changed. And to now say that we can't do it is crazy. But we're going to run out of time, and I don't want to run out of time without being able to allow this announcement that we keep talking about. We talked about it last week. We talked about it a little bit today, but we got 5 minutes, and I think that's what you need to let the world know what's getting ready to happen. So, Representative Jackson, do your thing.
Hello, I'm Derek Jackson.
Thank you, Representative Bruce.
Currently,
It's
I'm the
our
state representative of District 64. By now, you probably already heard that I've announced my candidacy for Lieutenant Governor in the state of Georgia. You're probably asking, why you? Why now? Well, my career path have prepared me for a moment such as this. See, after serving in the military for 22 years, retired military officer from the United States Navy, I realized that my leadership skills that I developed had gave me the capability and the capacity to make sure that I lead with a heart of compassion, demonstrating empathy when I need to, as well as sympathy. See, I understand families. I've witnessed it during my 7 deployments while I was in the United States Navy. But I also have 10 years in corporate America. Understand how to be efficient and effective, how to operate, and be one that understands how to balance to doing the right thing for the people and be in a position to do the right thing for the economy. I also understand that in these last 12 months, while we start to come out of this pandemic of the coronavirus, that healthcare in Georgia is going to be one of our greatest priorities. Right now, according to the United States News and World Report, Georgia is ranked number 43. And when you look at women's health, we're ranked number 47 out of 50 states. So as we continue to tout that we're the number 1 state to do business, are we the number 1 state for the people? This ad is approved by Derek Jackson, candidate for Lieutenant Governor.
And he got his education right here with us under the Gold Dome.
That's it, absolutely. So, listen, I will continue to do under the Gold Dome because this is important to me. But I also know that too much is given, much required. And I appreciate and respect my colleagues a great deal, but I appreciate their continued support and prayers. But we have to, we can't ask others to step up, and that broke our sleeve as well. So that calling has took place. I'm traveling across Georgia, so y'all see me in different locations on Friday, and I'll let you know where I am. But all in all, I truly believe in my heart, having my family support, having my college support, that we can make Georgia better. And we want to make Georgia better because we have to elect the right people, the right leadership, with the right experience. To move Georgia forward. And so I look forward to traveling across Georgia, listening more than talking, but understanding the heart of everyone in both urban, suburban, and rural Georgia. And so I look forward to serving as your Lieutenant Governor in Georgia.
All right. Ladies, anything? We got 2 minutes left.
I just wanted to say that Representative Jackson and I came in together, and in 2016 we were on the campaign trail. We have built a relationship. He is the epitome of a leader, of a father, of a friend, of a brother, of someone, like he says, with a heart for the people, and intelligent, adjunct professor working on his doctorate degree. So he has a lot of irons in the fire, but he is up for the job and he can handle it. And I am just so excited for my brother. I'm so proud of him. And I am 101% behind him in any and everything that he wants to do. And I look forward to seeing him as the lieutenant governor.
Yeah. He got something else. You got something else you want to announce too? Don't you have another, big event coming up? You don't want to talk about that? I saw it on the internet.
Who, me?
Yeah. I got something telling me to save the date. You don't want to talk about that?
Oh, we gotta stay tuned. We don't want to. Yeah. We can't get all the big news.
Well,
At the
listen,
same time, right?
I want to add, as it relates to Representative's announcement, I just want to say that you heard him. He's going to be traveling around the state. He is going to be listening to people, voters, trying to encourage us to get behind him and vote for him. But that is not an inexpensive endeavor. And running statewide is not the same as running in a district. And it does take dollars, it takes support, it takes resources. So even though he didn't mention it, I just want to say he's got a website. Check out the website. You learn, get to know him, and I've already made a donation to his campaign, and I just want to remind people that money really is the fuel of campaigns, and so if you see fit to it, make a donation because he's going to need it. It's not going to be an inexpensive race, and he's going to have to raise a lot of money in order to get where he wants to end.
All right. We are out of time.
Thank you, Senator, my good friend. I thank you. Thank you very much.
You're welcome.
All right. We are out of time. We've given you a lot of information, and we look forward to coming back to seeing you again next week. Same time, same station, and under the Gold Dome.
Under the Gold Dome.
That's
Until
what we'll
next time.
do. Under the Gold Dome.